This is Joe Lopreiato narrating my tech talk on the use of virtual patients in healthcare simulation. This talk is acknowledged with the help of the folks at the Institute for Creative Technologies at the University of Southern California and my own experiences. The outline of today's tech talk will be the definition of virtual patients, the current use of patients in healthcare simulation, some of the technology behind the creation of virtual patients and their capabilities, a summary of the effect of virtual patients on learning from the literature, and then some select references. Next slide. So currently we use humans for the most part in healthcare simulation when we want to interview patients or perform a physical exam or order laboratory tests. And we have several types of humans that we use in healthcare simulation. We have standardized patients who are adults or children that we hire from the community with a script to play a patient. We have simulated patients who are humans that we hire to portray their own health history. We have role players who may be actors or non-actors who we just use to play a particular role in a particular context. Or in mannequin simulation we often use what are called confederates, and these are humans who play family members and others who supplement the simulation of the mannequin. We use humans as in healthcare simulation because there's yet to be a machine invented that can express the full range of emotions that you can see with humans, from anger to anxiety to surprise and body language and those sorts of things. So that all of those are the reasons we still use humans in 2013. Next slide. Early attempts at virtual patients or the creation of them actually date back to the 90s, when we had simple video clips or still photos of folks either trying to make a point as a tutor, as you see here on the left, or there could be video clips of patients or still photos of patients, and learners would work through these slides much like a PowerPoint deck with either video clips or still photos posing as patients or providers. On the right you see another example of an attempt at virtual patients, this one by the Lairdall Corporation, trying to teach learners various advanced cardiac life support skills. And their virtual patients consist of cartoons that are animated and still photos of patients. And again, learners would work through each of these steps in advanced cardiac life support using either these cartoons or these still photos to represent patients. Next slide. So what are virtual patients? Well, virtual patients are computer-generated human figures, often called avatars, that can move and speak and respond to either the typed or oral commands of a provider or a learner on a computer. So they're a form of screen-based simulation. And what makes them different from the previous versions of virtual patients is that these characters are interactive. You can speak with them, they move around, they can show anger on facial expressions, and they can be manipulated by the learner to perform actions. If they're helpers, as you see up in the upper right hand corner, or if they're patients, as they are in the lower left hand corner, you can interview them. Next slide. The cost of creating virtual patients varies widely because the technology stemmed from the gaming industry and the movie industry. Initially, creating these avatars could be quite expensive. But as you can see now, there's a variety of ways to create virtual patients or virtual people, from simple animation on the left all the way up to high-grade movies on the right, where it can be up to $1 million a minute to create very sophisticated animations. But for healthcare, we don't need that level of sophistication. We can get along simply with either the animation or the next media phase, where these animations and avatars cost anywhere from $100 to about $5,000 a minute to create. So they're not cheap, but once created, they can be used over and over and over again. Next slide. The game engines that are now employed to create virtual patients are quite sophisticated and come from the gaming industry. So for example, there's a lot of code written for these virtual patients in the background to control things like environmental lighting, the scene models, the shadows, the background, for example, for the emergency room or for a trauma scene or perhaps a battle scene. And then of course the sound, both the sound coming from the patient and also picking up commands, verbal commands from the learner. All of these technologies have matured over the last 20 years, and anyone who's played a video game knows how sophisticated they can be. These same technologies are now brought to bear to create virtual patients. Again, much of the breakthrough in virtual patients has been the ability of artificial intelligence programs to allow virtual patients to interact with the learner on the screen, or the learner in front of the screen, I should say. And so when a learner asks a question, there may be a facial expression depending on the question asked by the virtual patient. There may be head nods or shakes by the virtual patient depending upon the questions asked by the learner. There may be gesturing or gazing. And also the type of answers that the virtual patient will give will depend entirely upon the type of question asked. Sometimes even in sophisticated programs, by how you ask the patient, whether you ask the patient in an open or closed way a question, you'll get a different answer. All of these involve fairly sophisticated artificial intelligence algorithms working behind the scenes to make the answers different for each learner, depending upon what kind of questions they ask. And this is again another breakthrough in the technology with virtual patients. Next slide. Here's just two examples of what modern virtual patients can look like. You can see they're much more sophisticated than the earlier versions of cartoons. These folks have facial expressions, they speak, they move their arms and their legs, they shuffle in their seat. And so they're very good at trying to emulate a little bit of body language in addition to having sound and responding to the questions of the learners. Again, these are because of new breakthroughs in software programming, again from the gaming industry. I've given you an example here on YouTube from two products from the Institute for Creative Technologies at the University of Southern California, both surrounding interviews of military members who may have post-traumatic stress disorder or depression. And if you go to this YouTube video, you can see two examples where a learner looking at a large computer screen can interview these virtual patients. And I want you to pay particular attention to some of the gestures and to some of the ways they answer questions posed by the learner. And as you can see, these types of virtual patients can be, if you use your imagination, more realistic than, for example, still photos or animations. So if you get a minute, go to this link and see an example of what a modern virtual patient can do. Next slide. When we look at the literature on the efficacy of virtual patients, we have to bear in mind that the technology has changed, and some of the earlier virtual patients were nothing more than those animations I showed, or still photos or videos. But in a critical review of the literature by David Cook and others, published in the Journal of Medical Education in 2009, he reported that when he looked at several studies, he found 8 or 9 studies that showed significant differences when virtual patients were used to teach clinical skills like history taking or physical exam compared to doing nothing in a variety of learners, and that those studies all showed positive effects, that virtual patients compared to no intervention showed improvement in skills like knowledge and history taking and physical exam. But when compared to similar interventions like standardized patients, there was little difference in the effect on learners in things such as the number of correct diagnoses or the types of questions asked during the encounter. However, when it comes to measuring clinical reasoning and figuring out diagnosis, it seems virtual patients were superior to standardized patients, probably because virtual patients allowed unlimited practice, unlike standardized patients. In another study by Amy Stevens and others in the Journal of Surgical Education in 2006. They published a result of single study in which they projected a life-size virtual patient onto the wall of an examination room and proved that compared to doing nothing, this type of practice improved communication skills of medical students in history taking around surgical patients. A more comprehensive study recently published in the journal Computers in Education in 2012 by Fabrizio Consorti and others sought to do a meta-analysis of the randomized trials of the effect of virtual patients in medical education, and the bottom line result was that virtual patients were good at teaching clinical reasoning skills, but not any better than traditional methods in teaching history taking or physical exam skills. So to summarize the literature we know so far, virtual patients are better than nothing, no intervention at all. They don't make much difference compared to standardized patients in eliciting patient data, but they're probably best suited for teaching things like clinical reasoning and working through a diagnosis, probably because of unlimited practice, and that certain communication skills in surgery can be taught by virtual patients. Next slide. So, to summarize, virtual patients are here as a modality that medical educators can use in healthcare simulation. That newer technology now that's coming along, especially our technology in animation and in artificial intelligence, can improve the reality by having the avatars move about or respond to questions or have facial expressions, which they could not do before. There are still many more questions to be answered about which designs of virtual patients would best have the largest effect size with learners, and in what contexts should virtual patients be used. Should we use them in the preclinical arena? Should we use them in the clinical arena? Should we use them to teach new skills? Should we use them to assess skills already taught? But clearly, virtual patients, unlike standardized patients, can have unlimited practice opportunities, and here's where I believe the disruptive innovation could be, in that if authoring systems and costs can continue to go downward, then we can create virtual patients in a library and have our learners practice on them ad nauseum until they get very good at it, and then use the more expensive standardized patients to test whether they learned anything. So in this case, virtual reality patients may in fact be a very good disruptive innovation and a cost saver when it comes to trying to teach difficult skills like clinical reasoning and communications. Next slide. So the questions that still remain are, can virtual patients be used to augment or replace standardized patients? The jury is still out, and there needs to be much more research in this area. I would encourage my healthcare simulation colleagues to think about enlarging your portfolio in screen-based simulation, specifically virtual patients, since new authoring systems are coming online, and it may be easier to create these cases than in the past. And then to test whether virtual patients, compared to either traditional clinical teaching or teaching with standardized patients, is beneficial or not. I believe that even if we have a non-inferiority, that is, virtual patients are as good as standardized patients are expensive. Virtual patients, once created, the cost is fixed and can be practiced on numerous times. And secondly, how will performance in virtual patients translate to performance of trainees or learners in the clinical world? That's the $64,000 question, and one that I believe we hopefully will answer in the future. Next slide. Here are some selected references of what I've already mentioned. The last two studies having to look at whether or not virtual patients can meet regulatory requirements for delivering standardized curriculum to learners that may not be at their institution. That's the last study. And the third study looking at whether or not clinical skills, that is history taking, physical exam, communication skills, can be taught best with either live patients or virtual patients, and it all depends upon the design. Thanks for your attention in this brief tech talk on virtual patients, and be happy to take your questions on email at joseph.lopreiato@usis.edu. Thank you.